Shelter-based care means that we're bringing care to people that are currently residing in shelters providing shelter for folks experiencing homelessness. So we bring our medical team into the shelter and bring that care to them in that type of a setting. People kind of say, well, why do you do this? Mm-hmm. And part of the reason is that the traditional setting sometimes doesn't work. I can give you an example. There's one shelter in East Garfield Park that is just a half a block away from one of our clinics. And somebody say, well, why don't folks just walk down a half a block to the clinic and be seen there? But there are lots of obstacles sometimes that people encounter. And sometimes we really need to bring services directly on site to folks in the shelter. Sometimes there are difficulties with appointments. I think one thing that when I'm talking with students that I say is that healthcare for folks experiencing homelessness is about number 7 on the list of things that they're working on. Mm-hmm. They're working on housing. They're working on jobs. They're working on clothing. They're working on trying to get food. They're working on getting their kids into school. They may have some legal issues. So healthcare, even though it's very, very important for folks experiencing homelessness, kind of drops down on the list. Right. And shelter-based care really expands access to the services that they really need. Mm-hmm. So that's why we bring the services to folks within the shelter setting.